Should every PCOS woman take supplements? This is a question many PCOS women face, especially when so many popular YouTubers and Instagram influencers, PCOS related, especially who are nutritionists or dietitians, who are promoting the benefits of these supplements. So if you're someone who wants to know what a doctor thinks about supplements in PCOS, please stay till the end. Hi, I'm Dr. Rashmi Pawar. I am a gynecologist who turned into a life coach to help PCOS women specifically manage their minds to get to their health goal, like weight loss or regulating your periods or clearer skin or natural pregnancy or just to feel better. So, coming to the topic, should PCOS women take supplements? Here's my opinion. As a doctor, we have to prescribe medication only if there is a valid reason, as supplements can have side effects and allergic reactions. We don't want to add to the suffering which our patient is already having. So we need to give medication which is always going to give them more benefit than risk. So unlike most medicines, supplements are justified when we have a report which states the deficiency, right? Like iron deficiency or vitamin deficiency, vitamin D deficiency or vitamin B12 deficiency, or like specific deficiencies specialist doctors who can do. If you have a report, there is an objective evidence, yes, there is a deficiency and we can give you that supplement. Or there are clinical signs which are suggestive of a particular vitamin or mineral deficiency, like calcium deficiency. We see it on the scans, right? Like the bones are like very weak. Or magnesium deficiencies that can like show up as like leg cramps. Or vitamin C deficiency, it can present as scurvy. So most doctors are trained to diagnose vitamin and mineral deficiencies just looking at signs and symptoms. We know what deficiency is producing that, and we don't need to do blood tests for that. We are trained to pick up from your clinical signs. Now in UAE, where I practice, and even in India, where I have sometimes dealt with insurances, most insurance company will not cover a supplement if there is no strong reason to support it, as in there is no report or the doctor has not pushed for this deficiency. Also, they have like a list of supplements they cover. So many of these new age supplements that will not be included in the list because they are brand new. So they will cover supplements like iron, vitamin D, folic acid, vitamin B12, as those are like proven blood report stating deficiencies. Now, if you live in a country where there is no insurance, like India again, where there is insurance but very few hospitals, but most places you pay cash, it can be even harder to justify these things. But in countries where insurance pays for these medications, they are very clear about what they're going to pay for and what they're not going to pay for. So apart from justifiable reasons, sometimes in pregnancy, these companies would approve of multivitamins and calcium without blood tests. Like even like many doctors, they can just write calcium deficiency depending on the clinical sign and support a calcium supplement. But if your insurance is not like good, it might still reject it. But I have had insurances, like patients who have excellent insurances, and still they would reject for certain things because it's not clinically indicated. There is no evidence to prove that this thing will actually support it. So some of these multivitamins, calcium would get approved easily by most insurances in pregnancy. The moment pregnancy is over, they will not cover it. Pregnancy, they will not even cover vitamin D, vitamin C. They will not cover even magnesium. If I put leg cramps as a reason, maybe they will cover it. So it really depends from insurance to insurance as well. Like many of them will not cover things which are like absolutely not indicated. Or it's just like complementary sort of. Like omega-3 fatty acids, many insurance will not cover in pregnancy. So supplements like magnesium, calcium, vitamin C, biotin, vitamin B complex, omega-3 fatty acids might get covered, by some specialized doctors, and depending on how, like, what kind of relationship they have with that insurance company, because if the insurance knows this doctor will fight for her patient, they might approve it, depending on, again, that doctor, right? So that is, if these doctors are like used to pushing, they know what insurance can do and what they are not doing, so they can push for it. But then again, many doctors will not take that effort because insurance will create a lot of drama to pay for these things. So they just tell the patients it's not covered, right? So then they have to pay from their pocket. Now, if the insurance is not covering, most likely you can live without it. But with PCOS, there are so many supplements which are recommended online. Like, just some of them which I know of is like inositol, omega-3 fatty acids, vitamin D, magnesium, CoQ10, zinc, probiotics, herbal supplements, I can't even say this name, resveratrol, calcium D glucarate, because the one which we prescribe in pregnancy and all is different. So I kid you not, none of these would be covered by insurance companies, not even inositol. Like, insurance company would barely cover metformin in PCOS. Like, we have to write insulin resistance is not even acceptable diagnosis. So so that is also sometimes a struggle for PCOS women. Like, it will be covered for like diabetes in pregnancy, it will be covered for pre-diabetics, but not for obesity or anything like that. So many companies will not cover these medications, as they're shit expensive, and secondly, they don't have strong evidence supporting their use. Even metformin. Can you imagine? But that's what happens, right? So many clients would pay for these unindicated supplements instead of focusing on food, which actually can correct their deficiency, because food is actually the best medicine, because most of these medicines were actually extracted from food. Like vitamin C, I don't know how they are making it, but like food like amla in India is a richest source of vitamin C. There is all your oranges and lemon and all the citric foods, they have vitamin C, right? Like similarly, many vitamin B rich foods, right? All your green leaf vegetables, all your fruits and vegetables would have, like, they're like power packed with vitamins and minerals. Like iron, there are so many iron rich foods that you can consume, like, and also like there are certain foods, like certain foods which can inhibit iron absorption. So there is a lot of things that we can do just with supplements, but at the same time you can improve your food so that you don't have to like take supplements, because they are expensive, they can produce side effects, they might not even work. So many of us would like just think that, you know, a supplement will be something which will actually help my PCOS, or I will reverse PCOS, but that is not the case. You can look at your food, right, and examine like how much of this food is like really nutritious, as in does it have any vitamins and minerals. Most of the time we are not consuming nutrient rich food, we are consuming empty calories, just bread, pasta, chips, like everything which has like no nutrition. There's really nothing in it except for glucose or trans fats. So we are not able to let go of these foods because we are emotionally connected with these PCOS causing foods. Now we need to take full responsibility for eating foods that are deficient in nutrients, right? Like, because if I don't accept that, you know, I'm not eating healthy, I can't work on this eating pattern of mine. So we have to take first responsibility that yes, I am actually not able to eat healthy food. There's actually nothing wrong with it. It's purely because our brain is like just conditioned to eat that way. We were socialized to eat these foods. Now these foods are harming us, right? But first understanding that yes, I have a nutritional deficiency, maybe, but at the same time, I need to cut back on my carbohydrates, because my carbohydrate intake is just making things worse for me. So instead of like carb-rich refined foods, I want to like eat all these nutritious foods instead, and take massive action to eat these foods to support our well-being. Now I help clients break their emotional connections with these foods. So there is help. for emotional eating, but we need to get help if we really want to reverse PCOS permanently. So your PCOS is actually reversible, and that's if you know how you're reversing it and you continue doing those things which keep your PCOS reversed. That's how you can actually permanently and sustainably manage your PCOS. And you can do all of that without taking unindicated supplements. I have never taken, purely because I don't like taking medications like a calcium tablet or any multivitamin or any sort of supplements that I have tried. Either it is difficult to swallow for me because I have sensory issues, and also it will produce this burp and side effect and constipation. I just don't like it. I just don't see the reason why I have to keep taking it. So I don't take it, and I just focus on my food, and by God's grace, I'm good. Like, I don't remember when was the last time I had a flu. Like, before, when I used to not look at my food, I used to constantly get flu, runny nose, all sort of allergies, aches and pains. It was just miserable. And once I cleaned up my food, I'm like so much better. It's like almost a rare event, even when I have a child at home who I sleep with many times. So even when she keeps getting sick, I don't, right? So that's because I know I'm taking good care of my body. And so I offer you this one exercise that you can try doing. This week, write down every food that you have eaten. Every day, at the end of the day or every morning, write down what you ate in the last 24 hours, every lick and bite. Do this for a week to see a pattern of how you eat. Now check how many of these food items are actually empty calories. Now if you don't understand what food has what nutrition, you can just Google it, right? Like, just write nutritional value of chips, nutritional value of rice, nutrition value of pasta, nutrition value of eggs, nutritional value of chicken, fish, all of that, right? Or French fries. So you can learn these things on your own, because for me also there were very few components of nutrition that we learned as a doctor, but I learned on the go to help my patients. So you don't have to treat patients, but you can treat yourself, right? So there is information available. Look at what you're eating. So finally, which supplement should a PCOS woman take? As per me, the only ones that correct a proven nutritional deficiency like iron, vitamin D, vitamin B12, that's if you have those deficiencies. If you don't have them, you don't need to take it. Or those that are part of good practices and recommended by a medical doctor who has diagnosed you with this nutrition deficiency just by examining you. Sometimes there are no clear-cut evidence, like especially with PCOS, and doctors would give these supplements like magnesium, vitamin C, B complex, calcium, omega fatty acid, and all of those above ones some doctors would give. Now if you want to try those, nothing is wrong with it. I'm not completely against it. It's just understand what is the effect it is having on you, right? So regarding all the supplements that are promoted online, if you're seeing an influencer promoting it, understand it has probably worked for them, or they are like into affiliate marketing, or like they're making some money out of it, right? But there is no hard evidence to support it, right? Because these social medias are directly influencing common people, right? It's like pharmacies keeping over-the-counter medication. These drugs are sold over the counter. You don't need a prescription for it. And pharmacists will come and promote it for you. So you have to look at it like, if a doctor promotes it, that means most likely it's indicated. Some doctors would still promote it. They get commissions, I don't know. They get some sort of incentives from pharma companies. So it's like, I want you to try and experiment on yourself, right? Like, while all these people have these benefits of monetary benefits with these drugs, I want you to understand that if you're taking it, get very objective around its effects. So once you start taking it, keep a data and take it at least for 2 to 4 weeks and see objectively which part of PCOS is improving. Are you like looking at cravings? Are they reduced? Are you looking at overall well-being? Are you looking at weight loss? Are you looking at like hair loss, acne, skin? Get objective about those. Like, are you actually feeling better? Now, also, I recommend you take one supplement at a time. Don't take the whole thing together, right? Because then you will not know if it worked, which one specifically worked, or did they all work together. We don't know that, right? Like, I want you to run that experiment on yourself We have all the time in the world. PCOS is a long game. So take one supplement at a time so you can know for sure which supplement is actually helping you and which is not. That is all I have to say for today. If you found this helpful and useful, please like and subscribe to my YouTube channel. And please feel free to comment if you have any suggestions or any sort of comments on whatever I have explained over here. Or if you want me to create some specific content around PCOS, please share it in the comments. Alright, that's it. Bye bye.